Thank you, Paul. And again, thank you all for your attendance here today as we again give you our daily briefing. And we appreciate your willingness to help share the information we have today. But let me first start by talking about what we've found to be kind of an interesting thing today. It's been reported that all students are to repeat their current grade. I want to remind everybody it's April Fool's. That's an April Fool's joke. And we are not doing that. If anybody has to repeat their current grade, it has nothing to do with the governor. We're not ordering that to take place at all. And so let's make sure we've been inundated with calls. And that is, in fact, not true. It's an April Fool's joke by somebody out there, not us. Secondly, let me just mention, I know that people are aware that we put together a public health order here 2 weeks ago yesterday, and it comes due today. And we are going to reissue that today for another 2 weeks up to April 15th. It'll expire April 15th at 11:59 p.m. So it's a reissue of the same order we had before with a couple of modifications. One modification is, in fact, that we've prevented from dine-in facilities to eating there and congregating in a dining room area. We're going to modify so that people can actually go into a restaurant and order from the counter and then pick up the food. If and only if social distancing can be accommodated, that means a minimum of 6 feet between anybody that's in line that comes in there. And again, we want to emphasize that strict hygiene takes place. We have hand sanitizer, that places are wiped down inside, doorknobs, handles, countertops, etc. are kept clean. That will be monitored by the local health department. And we certainly want to remind people that in spite of this allowance to go inside to order and to pick up food, that there should be no congregating of people into groups. Also, part of the health department order, we had an order of self-isolation and quarantine, and we emphasized for the following individuals. An individual who tests positive for COVID-19, beginning on the date that the individual tests positive, they need to go into self-isolation and quarantine by order. And an individual who's exposed to another individual who tests positive for COVID-19, beginning on the date of exposure, they need to go into self-isolation and quarantine by order. An individual who is a member of the same household or residence of an individual who tests positive of COVID-19, beginning on the date the member of the household or resident tests positive, also by order must go into self-isolation and quarantine for a period of time up to 14 days. You can get more guidance on this order that we're making here, this modification, from our Department of Health, and I know that Dr. Dunn will be coming out here, our epidemiologist, to talk about the latest statistics, and she can give more information on this self-isolation and quarantine order. Thirdly, I recognize not only do we have the health issues that are foremost on everybody's mind, we also recognize that we have the challenges of the economy. And I know that people want to meet their obligations, and rents and payments are coming due the first of the month for most people. I know that Utahns want to meet their obligations and do what they can. But I also know that because of the COVID-19, people have been struggling, and their own personal economics are hurting. Some have lost jobs or had hours cut back. They've been, in fact, impacted negatively by this COVID-19 pandemic. I want to express gratitude for the financial institutions who are trying to work with their customers and with our landlords who are trying to work with their tenants to find a way to get through this rough stretch of road. Again, that's what it's going to take, is all of us working together, finding ways to accommodate obligations and yet still meet obligations. And so I appreciate that, and we certainly recognize that kindness and salute their forbearance in these issues. But to those who are directly affected by the COVID-19 virus, this pandemic, and have lost your employment, I know that assistance is going to be coming available. And for you, you should go to jobs.utah.gov jobs.utah.gov, and file for unemployment insurance. It takes some time to process, so the sooner you get in and talk to our folks there, the sooner you'll be able to get financial relief. Our staff at the Department of Workforce Services is literally working 24 hours around the clock to try to accommodate those who are in need. So please fill out the unemployment form. It'd be better if you do it online. That will be easier and quicker rather than have to wait for a phone line to open up. Both ways are available, but it would be better if you could do it online. Again, jobs.utah.gov. Of course, we are waiting for money to come from us to utilize to help people, businesses, and individuals, employers and employees with the new CARES Act. That's going to take some time, and that will provide some additional relief, and we think will be very much needed and be able to be utilized in a very appropriate way to help people go through this few months of struggle. We also recognize that there is a lag time that takes place before we can get the resources to the individual. And so that's why today I'm announcing through an executive order that until May 15th, a tenant may defer rental payments. So up through and until May 15th, a tenant may defer rental payments. Also until May 15th, a landlord cannot initiate eviction notices. We've talked to the courts about this, the apartment association, and many others. We think this is an appropriate, practical notice to be given at this time to help give some certainty and eliminate some confusion and apprehension and fear that's out there in the marketplace today. By the way, this does not get rid of the obligation, but it creates some time and space for other measures to come into place. So again, what we do on a state level, what happens at our workforce services department, what's going to happen from the federal government with our CARES Act. This will buy us some time to get those in place to help alleviate the financial problems that tenants have, and landlords, people have mortgages with their financial institutions, businesses, employers, employees. So again, this will help us buy some time. This is designed to help people that through no fault of their own have lost job or lost income because of the COVID-19 virus. With that, and we go to the next issue, and that's talking about some of the fiscal issues that we face, certainly as individuals and families. I know that families are looking closely at their available funds, what they have on reserve, and that's the same thing is true for us in state government. We've been a government that's been very fiscally prudent. We have not spent foolishly in the times past. In fact, we've saved for the rainy day. And this is, in fact, a rainy day time. And so we're going to take a look at our rainy day fund and see what can be done. I want to thank the legislature for their prudent use of the taxpayers' dollars. The fact we have monies in reserve accounts and multiple different accounts on reserve, and we call our rainy day funds. And it's going to help us, in fact, to address this health crisis, to get through this with minimal damage. It is the legislature, of course, that controls all the money, and they're the ones that can release it and say how it can be used and where. And so I'll be meeting with the legislative leadership over the next few days to determine when would be the appropriate time for us to come into a special session to address these new fiscal needs and the challenges that we face here, not only completing the fiscal year of 2020, but also the budget we have in place for fiscal year 2021. I think we're in a good shape to get through this. And again, with federal funds coming to help us, I think that's going to make it very doable and possible to do this again with minimal inconvenience. I hope that we'll be able to have this special session by the end of this month. So again, I'll be working with the legislative leadership to determine when's the proper time to come to a special session and address these things, but that will happen shortly. Finally, let me mention this last issue. Again, we all know about the stay safe, stay home. That's the slogan. Everybody should say that to each other. Stay safe, stay home. And yet we're coming up to a spring time of year. The weather's going to improve. We have kind of vacation time coming up, spring break, general conference, other things that traditionally people have used as travel days. And we're going to say to you, This year is going to be a little different. You should, in fact, avoid travel. Stay home, stay safe. Any travel that's being done should be absolutely essential and necessary. I know there are great places to visit in this state, where it's a wonderful place with wonderful vistas and venues, but this is a time you're going to have to say, we're going to stay home and do something closer to home. We don't want you to go to other places and get infected. We certainly don't want you to go to other places and infect others that are been less impacted. And some of our rural areas, which are attractive and desirable to visit, are some of those areas which have got less infection. So we don't want to disrupt that. So again, we hope that you'll all commit to stay home, stay safe, don't travel anywhere unless it's essential to what you need to do. Let me just mention one thing too. Again, as we stay home, again, there needs to be prudence as we congregate as households. Again, inside your home, you ought to practice, good hygiene, sanitation, wipes for your hands and for the countertops where, in fact, the virus can stay for up to 2 days. Again, making sure we have good hygiene, all the things we've been talking about for these last 3 weeks, covering your cough, your sneeze. Again, keeping clean is important to do, even if you're staying in your own home with some of your household family members. So we would encourage you to, again, make sure you practice what we've talked about. Even though you're in your own home, these safe practices will help us contain the spread of this coronavirus and keep your family members safe. Again, if we do this, what the most, I think, difficult thing would be for us to go out there and know that we are the cause of some spread of this virus, and particularly hurtful to our own family and friends and loved ones, and to those we don't know. So again, as part of being a responsible citizen, stay safe and stay home. Let me just say also, I've added to this on our travel restrictions. We've talked about not going to state parks unless the state park is in your county. I've now raised that to an order. This is not just a suggestion. This is a new order that the state parks are now only open to people who live in the county where the state park resides. We'll have our state park personnel, in fact, enforce this with the backing of our health departments, our local health departments. They will, in fact, check your ID when you come in, check your residence, and if you don't reside in that county, you'll be turned away from the state park and visitation there. That's going to help us all not be tempted to travel when we shouldn't be traveling to go to some of our beautiful state parks. So be aware of this new order too. With that, again, I appreciate the attention and the work of everybody in the state. Again, I think everybody's trying to comply with what we're doing to make sure we get ahead of this and slow down the spread, in fact, stop the spread and get back to good economic times. With that, I've got a couple of minutes for any questions you might have.
Governor, how many ventilators does Utah have? How many do you project you'll need, and what are you doing to try to get more?
That's probably a question for Dr. Dunn. She can give you the update on it. I'm sure we don't have enough. Again, PPEs, personal protection equipment, has been a problem for us, the supplies of masks, and certainly for the medical profession, ventilators. I don't know what the number is, but we have 512, I think, beds, ICU beds, and I don't know that we've got that many ventilators. But Dr. Dunn will have a better answer for you on that one.
Governor, would you support a statewide stimulus plan like the federal government by cutting checks to adults here in Utah?
What was the last part? By doing what?
By cutting checks to Utahns, kind of like the federal government has promised to do?
Yeah, the question is, are we going to have a stimulus package here locally, here in the state, similar to what the federal government has? We announced one yesterday with GoEd, which is minimal amounts of money. I think a few thousand up to 20,000 to help small businesses be able to be successful and again tread water through these troubled times. So we've got that one already in place. We are going to be talking with the legislature, maybe a special session issue about what can we do to augment here locally for those businesses who have been impacted by COVID-19. I think the key issue for us all is those who get relief and help should be those who, in fact, are in most need, number one, and those two who have been impacted by the COVID virus, that's the motivation, or that's the reason, rather, that they've in fact had some financial struggles. So we will take a look at what we can do to augment that. Again, we know that the federal government has a significant amount of money in this first phase, $2.2 trillion. State of Utah will get 1.25 as a minimum, $1.25 billion, and probably some other add-ons that will come to the state of Utah. The president's talked about a second phase and with more money going to the states. And we would prefer as governors to have the federal government block grant the money to the states to give us more flexibility to direct those monies where it would be most useful and most effective. And every state is not the same, as you probably all know. So I think that's an important second phase that could happen. That's not happened yet, but it's been talked about. So bottom line is we're going to look to incorporate the federal monies into our local. Maybe it'd be a combination of us working together with federal monies and putting together a local program. Other question?
Hi, I have a question about testing. Yesterday you said you wanted to get to 7,000 tests a day. What's keeping you from testing that many people, and what has to change for you to get there?
The testing is an ongoing challenge. To be able to test everybody would be the ultimate goal. It'd be nice if, in 1 week, everybody in Utah could be tested. That would help us isolate and identify and track and trace the people who have been exposed or have it, so we could have really put a stop to the spread of the virus and actually help us really stop it from happening anywhere in the state. That's probably impractical, but certainly ramping up our testing to 7,000 a day is the goal we've set. We'll have some more information on testing probably here tomorrow or the next day as we're working feverishly to try to find ways to have more tests in the marketplace, quicker and accessible to not only just those who have symptoms, but those who don't have symptoms. And that's the goal. Again, Dr. Dunn might know a little bit more about that, but I think we'll have more information on that by tomorrow.
Yeah, Governor, with your announcement on the eviction freeze and rent deferral, is 2 weeks enough for this? And does your order apply to commercial businesses or just residential?
I didn't quite get that, so say it again, Ben, I'm sorry.
Sure. Your order on rent deferral and an eviction freeze and the eviction freeze is 2 weeks enough? And does this apply to commercial properties or just residential?
It actually goes to April 15th. It's a May 15th, a 45-day extension. So it's not just 2 weeks. I probably misspoke. I was thinking about we've extended tax day filing from April 15th to July 15th. But this will go to May 15th, so a 45-day extension. It's on any kind of eviction. The issue is, in fact, mostly, I think the ones that are most in the crosshairs are landlords and tenants in residential properties. We will look to see if there needs to be modifications of that. That order is in the process of being written up. We don't have it completed right now, but it will be shortly. By the end of the day, we'll have everything written up and ready to send out.
Hello, Governor. I'm wondering if you can explain the change at the restaurants, given that projections show we're still going to see a peak. That's still ahead of us in terms of, our hospital beds being filled and a peak in the disease spread. Why did you choose to make that change at restaurants when that can only increase contact between people?
We've had a lot of people talking about what's the right thing to do and the fairness of the issue. We certainly have the ability to get food in grocery stores where you can, in fact, have more, unfortunately, maybe more contact with people. The restaurants are saying we can keep the isolation down to less than 10 people in an area or less. We can have 6 feet of distance, and people can come into the counter rather than just pick it up at the drive-up window and pick up their products now. That's under the current order. The ability to allow them to, in addition to phone in or internet service, to make an order at the counter and then step aside in a safe place and wait for their order is something that can be accommodated safely under the restrictions we have on 6 feet of social distancing and physical spread, if in fact protocol are followed. So that's going to be monitored by our local health departments. Again, it's an if you can do this, then you can do that. And that's how it's going to be put into place, and we'll see how it works with our local health departments. Again, we think, local control on this is an important issue. You can imagine that it's a little different probably here in Salt Lake County if you're down in, say, Wayne County or Paiute County, which is a much more rural area. So we think this is a proper next step. It's a minimal change, but it will help accommodate our restaurants and people to maybe do more business and keep them afloat economically. With that, we thank you very much, and I'll bring in our next speaker, I think is Lieutenant Governor Spencer Cox.
Thank you, Governor. Ladies and gentlemen, welcome. I don't think I'll ever get used to this room without any of our reporters in here. Not something I thought I would say, not something I planned to say, but we miss you, and we're glad you're listening in. But I never thought I would miss Robert Gerke's snarky comments in the room, and Ben Winslow's great hair, and incredible questions. Bethany Rogers, Kate McKellar, all of you, just incredible reporters. I know sometimes you've taken a lot of hits, and I want you to know how much we appreciate what you're doing in the state of Utah to get the right messages out to the people, to let them know how very serious this is, and you're saving lives as well. So thank you for your incredible work. I'm grateful to be with you today. The last several weeks have been some of the most difficult of our lives, maybe the most difficult collectively that any of us can remember. But there are good things happening out there, and sometimes we need to remember to share the good things as well. At the end of some of the longest days I've ever worked, I've been brought to tears by the overwhelming goodness of the people of Utah, who are all looking for ways to make our state a better place and to help all of us collectively get through this very difficult time. Today I want to share some of that good news. Weeks ago, the Governor's Community Task Force and others put out a call for donations for personal protective equipment, or PPE. Our healthcare workers badly need it, and we still have a long way to go. But I am so grateful for the way that Utah has responded. Our response has been very strong. We have been humbled at the significant desire on the part of businesses and community leaders in particular to contribute to the effort to donate or create more PPE. Over 100 Utah companies have reached out to help our healthcare heroes. As a result of their generosity, Utah has so far executed purchase orders from 5 local businesses, and I want to mention them now, including Wasatch Innovations, a product development and engineering company, Fusion, a graphic design company, DPS Skis, which is a local ski manufacturer, the Queen of Wraps, a local vehicle wrap company, and Sugar House Awning, which does awnings, to create face shields and other PPE pieces. They've retooled their operations to make this happen, and we know that there are many more working on doing more of that. Intermountain Healthcare and the University of Utah are also innovating ways to make their own face shields and masks. This creativity epitomizes the beehive mentality of being industrious and lending a helping hand. If your manufacturing business wants to help, please visit coronavirus.utah.gov/help and look for the specific needs and how to meet them. For example, right now we have a very specific need for powered air purifying respirators, which is a mask that fully covers the face and supplies purified air to the person wearing it. If you are a manufacturer that can create these, please see coronavirus.utah.gov/help and reach out to us. Additionally, Utahns are particularly those in the tech corridor, but also elsewhere, are leveraging their national and international contacts to get Utah to the front of the line to purchase additional PPE and equipment from their global supply chains, and we're grateful for their help. There will be more announcements in the coming days about this from our hospitals, nonprofits, and religious partners, and I hope Utahns will pay close attention to this good news as we announce it and as it comes forward. I know that there are many many out there who feel helpless. We feel that way sometimes in our family, who are scared or stressed. I truly believe that one of the best ways to overcome that anxiety and that fear and that stress is to find ways to get engaged, to find ways to give back, to find ways to help others. I am convinced that because of who Utahns are and your generosity and your work ethic, that we will fare far better during this trying time than anywhere else. Utahns consistently lead the nation in charitable giving and in volunteerism, and those things will help us weather these difficult times. Now, not all of us can do something big like retooling our manufacturing operations to create PPE, but all of us can do something. You have amazing ideas. You see need around you. And some of you even have a little more and home with your kids, home working, or just home isolated. Again, my challenge to all Utahns is to do something. I hope by now you're all familiar with our state's website, coronavirus.utah.gov. Again, for all of us, we can go to that website, coronavirus.utah.gov/help, and you can learn about some of the amazing opportunities that are out there. Let me share just a few of those. The Feeding Our Frontline Community Fund. Every dollar raised will provide free meals at hospitals for frontline caregivers working tirelessly to protect our community. Another one, how and where to safely give blood. This is something I'm going to be doing this week. There's a huge need right now. Unfortunately, because of the limit on mass gatherings, many of our blood drives have been canceled, and we desperately need people to give blood. If you are in one of the categories where you are not as at risk, the opportunity to give blood is there. It is very safe. It is very sterile. You can make an appointment, and again on our website, where to safely give blood, click on there and schedule an appointment. Ty Burrell, whom all of us know and we're grateful, who has residence here in the state of Utah, has a food service workers fund. You can donate there on the website as well. Of course, you can help with our personal protective equipment shortage, and there is another link for support for small businesses, as well as the Silicon Slopes COVID-19 Utah Community Response Fund. And finally, there is a link there to support for vulnerable populations, including rent and mortgage assistance, rapid rehousing, crisis nurseries, and child care providers, and more. Ultimately, I want to say thank you to these amazing companies, and thank you to the incredible individuals here in the state of Utah that are sacrificing to improve the lives of others and help us through this crisis. Happy to answer any questions that you might have. Not seeing any, we'll go ahead and turn the microphone over to Dr. Angela Dunn, our state epidemiologist, for an update on today's. Oh, we do have a question. I'm sorry.
And thanks, Lieutenant Governor. This may be a question for Dr. Dunn. I'm just curious about employers and employees. I mean, what responsibility do businesses have to inform their employees if someone in their company is tested positive? And then we're hearing some employers are asking people for doctor's notes, which seems to go against what the health department has directed. So just curious about responsibility of a business to inform employees if someone is tested positive, and then what happens if you want a couple days off and your employer says, well, please get a doctor's note?
Yeah, so we'll bring in Dr. Dunn to work on those questions. I will say this, and we've been very clear on this. Please do not require a doctor's note to come back to work or to leave work. That adds to the burden of our healthcare providers, and that's something we desperately want to avoid. They're busy enough working with very sick individuals and working to help us end this pandemic. The last thing they need is frivolous doctor's notes. So please don't do that. Tracing is very important, and the local health departments are working on that, and Dr. Dunn can talk about the need to notify those who have potentially had contact with someone who has tested positive. So with that, Dr. Dunn, we'll turn the microphone over to you.
All right, good afternoon. I'm Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. Today I'll just give some brief remarks about where we are with our cases. So we have 1,012 COVID-19 cases diagnosed in Utah. That's an increase of 125 from yesterday, or a 14% growth rate increase. We have tested 20,155 Utahns for COVID-19. 1,642 of those results came back yesterday. We're still consistent at about a 5% positive rate for all people tested in Utah. We do now have 7 deaths total. We had 2 deaths notified yesterday in Salt Lake County. They were both over the age of 65 years old. 1 passed away in hospice care and 1 in a hospital setting. And with that, I'll take questions.
Hi, Dr. Dunn. This is Chris, George News. Well, I think at this time, you were mentioning about the fact that at the time the rate was probably about 14-12% growth, and mentioned that we really had a 14-day look at this. Where does it stand now? Are we seeing an increase in this rate? What is your point?
Sure. So I couldn't really make out what you're saying, but I think you're asking about kind of the 2-week trend in growth. So today we plotted our growth against an exponential curve, and we're well below the exponential growth of cases in Utah. We are starting to see a little bit turning of the curve towards flat, but again, this is only over the past few days. And so to really be confident in our projections, we look at the past 2 weeks. So we're seeing a daily increase in our cases. However, the evidence that social distancing is working is that we're not seeing a doubling rate or exponential growth in our cases. And that's because people seem to be adhering to social distancing measures that have been put in place.
Hi, Dr. Dunn. I'm sure you've probably seen these projections from the Institute for Health Metrics and Evaluation, but they're saying that our resource peak, hospital beds, ventilators, et cetera, that's not going to happen until April 23rd. And they're predicting a really big peak in cases and in our use of resources. Can you talk about that? That seems very concerning.
Sure, absolutely. So the University of Washington put out a study that looked at cases versus hospital resources for the U.S. as a whole, but then each state individually. And they predict that Utah will have a peak in cases at the end of April if we keep all of the same social distancing measures in place until then. Part of that prediction looked at hospital beds, and it said that we are not predicting to exceed our hospital beds. However, we are predicted to exceed our ICU beds and potentially ventilator needs. And so the point there is that we just need to really increase our vigilance in terms of making sure when we're sick and symptomatic, we isolate. We're not around vulnerable populations who are more likely to be hospitalized, such as older adults and those with underlying medical conditions. And then again, adhering to the social distancing recommendations that have been put in place by our governor is going to be really important to ensuring that we go below the projected numbers that the University of Washington has put out.
Yeah, Doctor, did I hear correctly when it sounded like you said we might be seeing the very beginning of the flattening of the curve, but it's still, we don't have enough days to kind of make sure if that's
Correct.
True or not? Is that kind of what you said, or did I hear wrong?
No, that's correct. But again, it's been this way for probably the past 4 or 5 days. But because there is a two-week incubation period for COVID-19, we can't be confident in those projections until we start seeing that decline and that flattening for a good 2 weeks.
Hi, Dr. Dunn. I guess I wanted to ask the same question. I mean, is there a mandate or responsibility for businesses to tell their employees if someone's tested positive? I know it's just a tough time for employees because some of them may fear losing their jobs if they take a couple days off for being sick, or they may wonder, why do I have to come to work right now? Let's say I work at a warehouse for Amazon. I'm concerned that there might be someone around me who's sick. What if my boss isn't telling me? What responsibility do employers have?
Sure. So whenever public health learns of a positive COVID-19 case, and we are required to know about all positive COVID-19 cases, we investigate all close contacts, and that includes business and employer contacts as well. And we work directly with employers to give them recommendations and guidance on how to clean their business place and also how to notify and allow people who were close contacts to be on home quarantine for 2 weeks. And so anybody who's come into close contact with someone with COVID-19, public health would reach out to them directly and work with the employers to ensure that those recommendations are taking place.
Yeah, so these are very specific, and we've seen in some other states that the ability to make these air purifiers. We'll put out some information on the coronavirus website, specifically in that section on PPE. But basically, what it is, it's a full mask that covers the entire face. It almost looks like a helmet, and then there's an air purifier with a hose that goes into the back of the helmet to fill the mask with purified air, and we have a limited need for some of those, and that's why that we have seen those being made in other states, and we're putting out the call here. So I don't have one to demonstrate, but I have seen a picture of one, and it does basically look like a helmet with a hose coming out the back connected to an air purifier.
Yeah. How many ventilators does Utah have? How many do you project you will need? And what is the state doing to get more if you need more?
Yeah, so I know we are working with all of our hospitals here in Utah to identify exactly how many ventilators they have. That final number is still pending, and we're expecting it in the coming days from our hospital supply work group under our incident command. The projected need is tough. I mean, the University of Washington study that was already cited says that we'll need around 120 to 150. But again, time will tell as we see how this virus spreads in Utah. We are doing everything to prepare for the need for more ventilators and be sure that we can source those readily.
The air purifiers that Lieutenant Governor Cox just mentioned, are those a replacement for ventilators, or is that separate?
No, yeah. So I believe the air purifier is about personal protective equipment for healthcare providers so that they can care for patients without risk of getting infected themselves.
Dr. Is a stay-at-home order off the table? And do you yourself think, that we need to go there?
Sure. So the governor has put forth a statewide directive, and we expect everybody in the state to adhere to that. And that means staying at home, only leaving for critical services, and especially if you're vulnerable, making sure that you are maintaining good social distance. And so those orders allow the local jurisdictions to elevate that if they see that they want to enforce that locally within their jurisdiction. So we do have that statewide directive and are expecting everybody to follow it.
I had a question about the same study from the Institute for Health Metrics and Evaluation showing that Utah could have daily death counts around 18 deaths per day for about 5 days in a row, April 22nd to April 26th. Do you have a comment on that? Do you agree with that curve and when we might see peak deaths in Utah?
So that curve does provide us some evidence. I mean, there are a lot of models out there, and we look at those to just make sure we're prepared for every scenario moving forward. We are certainly working towards making sure the least amount of deaths are occurring in Utah every day. So I hope we don't reach that number, but we are preparing for those situations.
Thanks. One more question here. Concerning the statistics you released yesterday, concerning age demographic, what's interesting is it appears, if I'm correct, about 41% or so of cases have been between those in the age range of about 24 to 45.
Right.
With 11% being those 65 and above. What is the reason for that? Obviously, everyone has talked about this being more of a situation for the older people in the state, but it's certainly the statistics may not be panning that out.
So the question is about our demographic spread. The vast majority of our cases are between the ages of 25 and 45 or 25 to 65. We do have a younger population in Utah than the rest of the U.S., but this really speaks to the point that everyone is at risk. That age group is at risk for getting COVID-19 and being hospitalized. However, we know that the most severe outcomes, such as needing an ICU bed, needing to be intubated, or even death, occur in those greater than 65. So it's essential that everybody maintain social distancing recommendations and also self-isolate upon having symptoms, because we are all at risk.
Hi. Going back to what you said about the recommendations that you give businesses once you learn that maybe one of their employees has tested positive. What are those recommendations specifically? Must they tell other employees that this person has come in contact with? We're getting a lot of tips from people saying, so-and-so in my organization tested positive, and it's just business as usual the next day. Can you give any guidance on that?
It is absolutely public health's role to ensure that everybody who has come into close contact with someone who has COVID-19 knows that and quarantines themselves, monitoring themselves for symptoms. So public health will work with employers to figure out the best way to notify employees of their risk, but it is falling on the local health department's responsibility. And so I think people out there can be assured that if they have come into close contact with someone who has COVID-19, and if they should be quarantined, they will be notified by their local health jurisdiction. Mm-hmm. So, yeah, sure. So the question is about the case in Central Utah. So we reported that yesterday. Central Utah now has a case of COVID-19. This person is recovering at home, and it is believed to be a travel-related case, meaning the person was exposed outside of Utah, and that's how they contracted COVID-19. We now have one case in every single local health jurisdiction in the state of Utah. Perfect. Thank you guys so much.
Thank you so much. As we wrap up here, let me just give a few notes here to our friends in the press. The media has done such a great job of covering these press conferences. We, again, appreciate your forbearance with sometimes how the time changes from day to day. Our effort is to see that these are now done each day at 1 o'clock here in the presentation room in the Capitol building, and that there will be one presentation this way that will include information from the health department as well as the governor's daily briefing. So we hope that that will work well for you. I do just want to give a big shout out here to our friends at PBS Utah and Fox 13 for their help with the technical support that's made these daily briefings possible, and also the able assistance of our ASL team, Clay Anderson, Trenton Marsh, for their excellent work, and our Spanish interpretation being done by Katerina Watson and Edwin Espinel. Thank you very much for your support, and we look forward to seeing you tomorrow. Thank you.